a lot of work.
Okay, Lux, I think you can disable the waiting room if you haven't, and then good afternoon for everyone joining. We'll give it just a minute here while people join the room. Let me give it one more minute and dive in. We have a lot to cover today. You see a question, John? Did you have your hand up?
Sorry about that. It was a misclick.
Nope, I was gonna say maybe it's an accidental hand, but you're welcome to speak up. The awkward silence as we get started. I keep saying I'm gonna play music or trivia at the start of these, so I'll go ahead and get started. It looks like people are joining, and we do have a lot we want to cover today. So welcome everyone, and thank you for coming for the TEFCA Public Health Community of Practice. It's being led by the Office of the National Coordinator for Health IT and the Centers for Disease Control and Prevention. My name is Liz Abbott, a contractor with HLN Consulting, supporting the facilitation of this COP along with other HLN, ONC, and CDC colleagues who are also on this call. And so today we're very fortunate to have some legal experts from ASTO and the Network for Public Health Law to provide us with an overview and guided discussion around legal considerations, which I know is a topic that comes up almost or probably every time that we have met in the COP. And we're also going to hear from the experience of Fairfax with some of their progress in the legal space. And we'll have plenty of time for discussion around that. And then we'll also hear from ONC regarding the COP transition, and want to save some time to hear from you all related to what you want to see more of in the future when we consider what a future COP might look like. So I basically just said all of this, but following today's meeting, you should be familiar with some strategies for how to approach your legal teams around various TEFCA implementation considerations. And you should have a better idea of what the next steps are related to the future of this COP. So these are just a few housekeeping reminders before we get started. Please feel free to rename yourself to include your stilt agency, your jurisdiction, or your association acronym, so we know where you're coming from. I see many of you have done that already. And everyone should be muted upon entry. Please stay on mute when you're not speaking, but for discussion and Q&A, please use the chat or select the reactions icon to raise your hand, and definitely we want to hear from you. And then if you have any technical issues, please reach out directly to Lux Fatak in the chat. And as you should have been notified when you joined, this meeting is being recorded. We'll be sure to share out the link as soon as it is available. One other item for today, I'll just quickly mention towards the end of the meeting, as long as we do have the time, we're going to try to fit in a quick Menti. So I think most people are familiar with Menti polls, but just we'll have an instruction slide, but be ready to open up a browser on your phone or your desktop to enter the code to participate in that, because we'd love to hear from you when we get there. So I'm going to pass it over in just a moment. I'm really pleased to introduce Lillian Colasordo, the Director of Public Health Law and Data Sharing at ASTO, to provide an overview of legal and policy considerations for TEFCA. Following Lillian's presentation, we're going to hear additional perspectives from Chuck Curran and Stephen Murphy from the Network for Public Health Law. And then we will hear about the experience from Fairfax County. We have Ben Cluckamp and Noelle Claren on. So really lucky to have a great lineup of people to share out today. And then we'll have questions and discussion, and would love to hear from everyone else. So Lillian, I will pass it over to you, and I can just advance as you let me know.
Great, thank you. So as Liz said, my name is Lillian, and I'm actually the community of practice rep, one of the reps from the Association of State and Territorial Health Officials. So I sit on these calls as well, and it's been great to learn more and get to know more about the questions that folks have. Just by a little way of background about me, so you kind of understand the lens and perspective that I'm bringing to this. Before joining ASTO, I was an assistant attorney general for the state of Vermont, where I represented the Department of Health. And before I moved to the AG's office, I was a policy advisor for the Department of Health and Commissioner's office for a number of years. And so that's kind of led me to this point in my career where I think my two favorite things in the world to do are give trainings to public health programmatic staff on how to talk to lawyers and how not to be afraid or annoyed or downright livid at their legal counsel all the time. And conversely, how to teach lawyers to stop saying no and what they could be saying instead, and how to ask better questions of their staff. So I think this talk today is going to be a little bit of a hybrid of a lot of those comments. As I mentioned, I am an attorney. This is the usual disclaimer that you always have to hear from us. But I am not your attorney, so nothing that I say here today should be construed as legal advice. But we can get started then. Next slide, please. So we don't need to spend a lot of time, thankfully, with this crowd on the background of TEFCA, which saves us a lot of time and a lot of slides. But just as a way of the level set, a reminder that the Trusted Exchange Framework, it describes this common set of non-binding foundational principles for data exchange policies and practices that can help facilitate exchange among health information networks. And one of the principles of that framework includes the exchange of public health data. So it is core and integral to what TEFCA is all about. The legal components that it's important, and we're going to dig into these a little bit more to start learning more about and bringing forward to your legal counsel at your agency, are first and foremost the common agreement. Now, this one's a little unique because the common agreement is not really a contract. It's not an agreement that public health authorities are really likely going to be a party to, but it's important to know what's in it. That's because the common agreement is going to be signed by the RCE and any QHIN, and it defines the baseline legal and technical requirements for the secure information sharing on this national scale. But provisions of the common agreement will flow down to the entities within the QHIN's networks in their other agreements. So we'll talk a little bit more about what that will look like. I do want to point out, and this likely has already gone out to this group, but just because I think repetition is great, the RCE developed several SOPs to guide data exchange under TEFCA. And on August 6th, so not that long ago, they just published the final public health SOP after reviewing all of the feedback from the public health community earlier this year. So I've dropped the link in the chat for everybody. Next slide, please. So as I mentioned, there's 6 exchange purposes for TEFCA, and these purposes identify the reasons for which information can be requested or shared through a QHIN to QHIN exchange. And these purposes are all authorized under the common agreement. Only treatment and individual access services are going to require a response. As of February of this year, public health is not required to respond to queries. This becomes important later on when we talk about having conversations with your lawyers. Meaning that healthcare providers may be required to push or send data to a public health authority, and a public health authority can query or request data from a healthcare provider, but public health authorities are not required to respond to queries from another participant or sub-participant. I see we have a couple hands, I think, that have gone up. Liz, do you want us to hold questions or take them as we go through?
I think if we can wait to the end, let's let you get through these.
Okay, perfect. So the one exception where a public health department might be required to respond to queries is when a department is acting as a treatment provider, which we know many health department programs do. This may also trigger requirements on the information blocking rule, which we're not going to discuss today, but it's good to know about. Next slide, please. So sharing sensitive health data can come with very significant legal risk. And it's important to involve your legal counsel early and often when planning for any new exchange practices, but particularly TEFCA because this is going to be big and involve so many different entities. I know that talking to your attorneys can be daunting and at times even frustrating, but you have to remember before you go into any conversation with them, attorneys are smart and sometimes think that they're the smartest people in the room, but they do not have the same technical knowledge that you may have about data exchange practices. So first and foremost, be patient with them. Explain it to them like you would a 5-year-old multiple times if you have to, because it's important that your attorney understands these concepts. It's going to help them make better decisions and I think become less of a roadblock or a barrier that you've got to figure out how to, quote unquote, get around. Next, I saw the comment. I would agree too. Hopefully the ones that are representing health departments are though. So next, come prepared with as much information as you can pull together about how this will all work. That includes data flow diagrams, any existing SOPs, and any relevant law that you are aware of. Now, it varies from health department to health department on how your legal counsel may work and be structured. So if you work for a huge state agency, you may have multiple attorneys that work on specific programs, and that's all they do within the health department. So they really become subject matter experts, but a lot of attorneys that work in public health are generalists, especially at the local and tribal level, where you may be working with like a city attorney who specializes in municipal law, and then all of a sudden you're throwing these public health questions and data sharing questions at them, and they've no background in this. So programmatic people are the ones that are working within the rules and regulations and statutes for their particular data every day. So if you know the citations to those and you have a meeting with your attorney, pull them together to prep your attorney and to give them to them in advance or show up with them in hand. It's going to make it go a lot smoother and save them having to do some background work and make them feel more comfortable quickly reviewing that language with you there and being able to have a informed conversation. And then last, making sure you stay curious. As I mentioned before, doing some trainings and the network has a great training on getting to yes, on how to talk to your attorneys about getting them to say yes instead of just saying no to everything. One of the biggest things that you can bring is curiosity. So if your attorney starts to seem like they've got some concerns or they're automatically saying no, ask more questions and talk to them more about what the overarching goal is you're trying to accomplish, because the worst thing that can happen, or the worst things that I've seen happen, are when health department staff come to the attorney with this very narrow, very specific question about what they want to do, thinking that if I give less information, I'm less likely to get in trouble or have them tell me I have to stop doing everything the way I'm doing it. And that honestly is the worst thing you can do. Anytime anyone shows up at an attorney's office with a yes or no question and no other information is being provided, the answer is going to be no. So ask more follow-up questions, provide them with more information, give them the broader context, talk about why this is part of your agency's broader goals, bring in other members of leadership if you need to, just so they get an understanding and they can start thinking a little bit more creatively about like, okay, I see what we're trying to accomplish, and we might not be able to do it this way, but I think there's a pathway this way. And it's very important to function as a team with your legal counsel. One of the things that I was really, really fortunate about in my position is that even though I worked for the Attorney General's office, I was fully embedded within the health department, meaning physically my office was in the building with the other staff, and they could come to my office and ask me any questions they needed. I know that's not a luxury that every attorney has or that every health department has to be able to just run into their attorney's office whenever they had a question. But really, as much as you can, try to start getting your legal counsel to be part of the broader team. It's also just smart to have them involved in conversations earlier on in order to avoid moving down the road on an expensive and time-consuming project only to learn that I don't think we can do this because it's not in compliance with our law. Next slide, please. So diving into some of the specific policy and legal considerations under TEFCA, as we discussed earlier, the RCE signs the common agreement with the QHINs, and the common agreement provides certain flow-down provisions that the QHINs are going to be required to include in their framework agreements with participants. This is kind of different new language that you might not have seen before, but essentially, think of what you might sign with a QHIN as any type of vendor agreement you would have done with an IT provider in the past. And what this means is that that agreement, that their vendor agreement that you sign with them is going to have the same legal provisions that flow down from that common agreement, which is why I mentioned it's good to start having your counsel review the common agreement now. And then any participants, if you're not a participant directly with a QHIN, participants will be required to include flow down provisions in the framework agreements with the sub-participants. Best example of that is an HIE acts as a participant connecting with a QHIN, and you then participate through an HIE that you may already be connected with. So they flow down multiple levels if needed. Sorry, I've lost my place in my notes. So examples of what some of these flow down provisions might include, things like the use of the RCE directory, expectations around how participants and sub-participants request information and respond to queries, privacy, security standards, et cetera. So any public health authority, including the agency itself or its delegates and bona fide agents, can connect to a QHIN and sign a framework agreement to be a participant or a sub-participant. And then the agreement allows the entity to register as an endpoint in the RCE directory, which is sort of akin to having like a post office box within the network. So TEFCA is very specific that all data exchanged is subject to applicable law, which could be state, tribal, local, territorial, or federal. And if there's a conflict between the applicable law and the provisions of the common agreement, there is an order of precedent, and TEFCA explains that the applicable law comes first. So it is critical for legal staff working with you to be familiar with the applicable laws in their jurisdiction when reviewing the flow down provisions in a common agreement and framework. Many agencies I was actually just talking to Connecticut as part of a panel that I was moderating last night, are conducting this agency-wide inventory right now of all of their data sharing laws, and as prep work on how to create this inventory that they'll then use for any type of, whether it's through TEFCA or other data use agreements that they enter into, because they had not, at least in recent years, hadn't taken the time to pull everything and put it all in one place and see what data are we collecting, under what authority, can we share it, how can we share it, do we need to make decision trees, that sort of thing. So before anything else happens with TEFCA, there's quite a bit that you can be doing in preparation. And I think this is a great first step. Next slide, please. So this is why I think this is a great first step is because the jurisdictional limits on data sharing are likely to be the most important piece to the legal puzzle you're trying to solve. Your attorney's likely going to have a lot of questions about how a QHIN or a participant like an HIE will actually abide by these with data coming from so many different sources. I am not a data or IT expert. I am fortunate enough to be married to a database administrator, so I've absorbed a lot through osmosis, but not enough that I feel like I could adequately explain this. So I think having those conversations and having your attorney even potentially involved in conversations with a potential QHIN or participant is going to be really crucial in order for the attorneys to feel comfortable with, yes, we believe that this is going to work. They're aware of our laws. They know how to adhere to them and the restrictions that we have to place on data. This is all particularly true if your agency plans to share data out instead of just pulling data in. Next slide, please. I'm not going to go through this in great detail because, as I said, I am not a data technical person, but Washington State has put together this great conceptual framework for how data could be exchanged through TEFCA's network. And I just wanted to give it as an example to highlight how one jurisdiction is thinking about data exchange. And as an example of something you could provide to legal counsel, when I talk about this data flow map, something that you can provide that really highlights and shows what direction things are going and how this is working. This also does a really good job, I think, of showing CDC's role that they may play in this as well, both from receiving data from STILT via a QHIN or directly from healthcare providers via QHIN without any STILT involvement. Next slide, please. So finally, just a quick word about HIPAA, the Health Insurance Portability and Accountability Act. HIPAA applies to covered entities such as providers. And if you don't already know, you should ask about how your health department is or is not covered. Most health departments house at least some programs and activities that require they comply with HIPAA. An agency can kind of either be a fully covered entity or a hybrid agency, meaning that only certain programs are covered. This is likely something you already know and had to take HIPAA training on when you started your position. But you want to make sure if you are unclear that you talk to folks within your agency to understand whether the data you're going to be exchanging is subject to HIPAA requirements. But generally speaking, TEFCA was designed to work within these requirements. Next slide, please. And then before we move on to discussions with the network and any follow-up questions, I see hands up. Just wanted to drop another resource in the chat beyond just the SOPs. In full transparency, I have been out on medical leave for the last 6 weeks, and I'm just coming back in now. So I can't answer any, thankfully or unthankfully, can't answer any questions about this. But just wanted to highlight, I think it was discussed in last month's call. There's a new proposed rule from ONC that overlaps and goes through a lot of stuff having to do with TEFCA. And the comment period for that proposed rule ends on October 4th. So if you're participating through something like JFIT or your agency is looking to submit comments on its own, just a reminder that that deadline is October 4th. And also a reminder that ASTO is going to be hosting an informational webinar for the implementation centers next Wednesday. And at the end of the meeting today, there will be a link dropped in the chat for that as well. Next slide. And I think the next slide, I think, is either network or questions. Oh, thanks, Lex.
Thank you, Lillian. We're so grateful you're back. That was such a great overview. And Steve, I see your hand up. If we can wait just a couple more minutes, I'm going to let Chuck and Stephen kind of provide some of their perspectives to tack on to what Lillian just covered, and then hear from Noelle and maybe Ben from Fairfax. So let's do that first. And if people do have other questions, feel free to start putting them in the chat, or we'll open it up for you to raise hands afterwards. But Steve, we will get to you in just a second.
So thanks, Liz. This is Chuck Curran. I'm a deputy director with the Mid-States Network for Public Health Law, and I'm going to build on Lillian's excellent presentation, and not so much on the legal specifics as thoughts for good process on how to approach TEFCA implementation. I think the first point, and Lillian emphasized this in terms of having a good encounter with legal, is to consider whether you're solving to a specific use case or whether you're actually solving holistically to potentially multiple use cases to take advantage of everything that can offer. And there's starting to be, I've just dropped in the chat some links, there's starting to be sort of compilations and resources indicating the full range of possible TEFCA use cases that have public health benefits. So I think, to Lillian's point, you want to have a point of view of whether you're, as you go through the legal analysis, you're going to do it for just one use case, or you're going to, where there's some potential synergy, where there's certain commonalities, you can actually look to the broader impact that TEFCA could have for multiple use cases. And certainly Craig, who's covered these, some of the really cool use cases in the Helios Accelerator, is just showing that these, and I think Fairfax will speak to this, the number of pilot cases is sort of multiplying. So that's just something to consider as you approach and sit down with your counsel. The other point holistically is also to emphasize to your counsel that the common agreement doesn't stand by itself. It is heavily interrelated with so many of the other documents in the essentially the governance framework for the TEFCA participation. And in particular, I think it's not intuitive to attorneys that the exchange purposes document would also really contain important provisions that gate which entities are in or out for certain requirements. There are important provisions addressing the obligations or exceptions for public health entities. I think it's helpful to also emphasize the interrelatedness of the framework for TEFCA and how that actually translates into understanding that maybe there's an easier path than expected to stepping into TEFCA participation as a public health entity. So I'll leave it there.
Thanks, Chuck. These are great resources and reminders, some that have been shared, some that have not, I think, through this COP. And, Rachel, I don't know if you wanted to say anything about the webinar for the SOP.
Yeah, thanks so much, Liz. I did want to mention to the group that the recognized coordinating entity, the Sequoia Project, which is overseeing TEFCA, they will be hosting a webinar in the very near future, hopefully in September, as it relates to the release of the public health SOP. And we'll go into more details. They're gonna do it to the broader, open it up to the broader public health community. So we will make sure that you guys get information on that as soon as we have that information ourselves.
Thanks, Rachel. And thanks again for adding all those considerations, Chuck. I think it was a nice tack on to what Lillian covered, and Stephen will be here as well when we get to these discussion items and questions. And I think, Stephen or Chuck, do you have anything else that you want to add before I pass over to Fairfax?
No, I think it'd be great to hear how they got to yes.
Let me throw in
and the getting to yes. Oh, go ahead, Stephen.
Sorry, Liz. I really appreciated Lillian's presentation as well, particularly around working with your attorney. And I love Lillian's comment that some attorneys love to say no. And certainly in the data space, that is absolutely true. And sometimes you have to kind of take attorneys on a journey around risk taking and the level of risk taking, because sometimes there is some ambiguity in the law. But I think also it helps to have what I've heard referred to as an executive sponsor, somebody in your organization that's higher up that, if they want it to happen, it'll happen. That's often very important. And then I just wanted to mention also data flow maps. I know that they mentioned once or twice, but public health data attorneys love data flow maps because it helps us think through the different legal pieces and the different legal questions. And many of the questions here that, we've already kind of been thinking about are around privacy. And so data flow maps in particular are very helpful to think through those privacy questions and which laws may apply. And there's a lot of talk about HIPAA, but public health data attorneys will know that state law is often many of the legal problems that arise in the context of exchanging public health data. So with that, I'll just pass it back to you, Liz.
Thanks so much for adding that in. So Noelle, can I pass it over to you to hear what you've been able to accomplish and work on in Fairfax?
Sure. Thank you, Liz, and thank you for the group allowing us to chat today. But my name is Noelle Claren, so I'm the Informatics and IT Director in Fairfax County, Virginia. And so just reiterating how we got to yes and how Fairfax was sort of a pilot and getting through some of these legal processes for TEFCA. I just want to say to Lillian's sort of presentation and a sense of the advice that she was giving, I think it validates a lot of the work that we've been doing. So really communicating with your legal team is key. We've been fortunate enough to be working with our legal team over the number of years on several types of data sharing agreements, both locally to our state, but also partners within Fairfax and other states. And so at least this wasn't the first time that we've certainly walked through sort of a process with our legal team, but a lot of it was working with them in understanding our specific use cases, as Lillian and Chuck had mentioned, like walking through the specific programmatic examples of how we would use TEFCA and where it would work on. That was key and important in explaining to our legal team, and then just ensuring that we had the appropriate controls in place to sort of justify or put them at ease of any concerns, right? And so some of the concerns, not just from our legal team, but even from our central office of IT, when we're thinking about data exchange electronically, how are we going to handle security and storage, the usage and scope of the data, the access of that data, and what mitigation controls did we have internally? I think those are all important things that have to be discussed or set up before really applying or utilizing the TEFCA network or just any of the technologies in general. And that was really what was helpful for us, is just ensuring that we were communicating appropriately with the legal team, keeping them up to date on the project, and working very closely with our programs on how we would actually use this. I'm going to pause there, and I have a colleague, Ben Kleekamp. He's actually our communicable disease manager within our epidemiology and population health division. And I don't know, Ben, if there's anything else that you would suggest or kind of reiterate that helped us get the yes from our legal team.
Yeah, thanks, Noel. It's great to be here. We have gone through some of these data sharing agreements, and some of the stuff that Stephen was mentioning is stuff that we just kind of stumbled upon, where I'm going to the legal and I want to get data from point A to point B. I need the sharing agreements, and I'm going through my spiel, and then they said no. And so then I go through the whole process of like, okay, well, they're not going to bend, maybe I'll bend them around them. So how do I change my business process to get the yes? And so, they'll probably say no a couple more times, but then actually coming back with the data flow diagram to actually let them see exactly what I'm trying to do and allow them to pick that apart has actually been something that has helped us in a couple instances of getting that yes. And I guess I would just iterate to all the other EPIs out there is don't be scared of the lawyers. They'll tell you no, but you just got to think creatively. Having been in government for over 10 years is continuing to think creatively about how you can actually get there and actually help your residents is really important. It's really important to be resilient in the face of some of the bureaucratic and very important bureaucratic things that we have to go through. But there is often at times a way to find that yes. So I'll pause there and we'll pass it back to you if there's for anything else.
Yeah, thanks for adding all of that, Ben. I think just to kind of summarize some of the things that we're doing here to keep us going with this momentum. We do have sort of standing meetings with our legal team as well as other stakeholders that are part of the work that we need to do within our health department. And so that's one way that helps us keep them involved of what's happening. And I would also just suggest, as you look at your organization, how big or how small it is, thinking about how do you centralize or standardize these types of requests to the legal team. I know in the past for us, it was sort of onesie, twosie requests from all the different programs. And so we weren't all on the same page before we even presented it over to our legal team. And so centralizing it over to, at least with our informatics team, is I manage a lot of the data management here locally, but also with other stakeholders, we're able to centralize our requests, go through the purposes, and really just justify it internally before we take it up to that next level. And so those are some practices that we're trying to continue and implement every day. And I think that's helped us get through a lot of these yeses, not just for TEFCA, but even a lot of our local to state data sharing agreements and things like that. So thank you.
This is really great. So appreciate you guys sharing all of this and all these different bits of advice. Hopefully everyone else is finding these helpful and taking notes. I see a future tips for getting to yes sheet, Lillian. No, but I think we could go ahead and jump into that discussion. So thank you all. I will start with you, Ike. I know you've had your hand up. Thank you for your patience. So please go ahead and unmute and
Thank you all for sharing this afternoon. I think there are still some issues we need to look at as we look at the SOP and some of its potential implications from a legal perspective. And would love to hear some comments looking at how to best address the fact that TEFCA really is a network of QHINs, and where there might be a relationship between a particular public health authority and a particular QHIN as far as data flowing through that QHIN, as at the end stage, that many providers may be connected to other QHINs as part of the overall network, and data may be flowing through multiple QHINs to get to the destination public health authority. How do we resolve educating those other QHINs about the requirements for state law in terms of meeting the reporting requirements? Because that's a major undertaking to educate one QHIN, let alone 6, 7, or 8 or more.
So I'm happy to take a stab at this, but I think you've done a great job of really highlighting, I think, one of the integral questions to how this is all going to function. From my understanding on this, it's not necessarily that every QHIN has to know and be familiar with every single state's laws if they're not, or jurisdiction's laws if they're not signing into a participant or sub-participant agreement with those organizations. The gatekeeping that would essentially happen to make sure that data is being protected and shared in compliance with, local laws would happen with that initial QHIN. So a query would come in. Let's say, I'm going to use states just because since I can't draw you a diagram, which is the way I like to do everything. Let's say we have California, and we're going to say there's one QHIN that deals only with California, and California has its own laws, that QHIN's familiar with them, but then let's say Massachusetts wants to get some information and they're querying, and they have a QHIN that handles all of New England. So it's the New England QHIN. And that QHIN, the New England QHIN, sends out a query to California QHIN. It's up to that California QHIN to make sure they're not oversharing information that's not allowed to go out. And so whatever's coming into that New England QHIN is already kind of in compliance. Now, I'm not sure if maybe your question's coming more in terms of what if it's required to be reported? If what Massachusetts is requiring is above and beyond what California can share, and in which case, normally Massachusetts wouldn't have jurisdiction over California's data anyway. So it's not something they would have gotten previously. Like, let's say it's a immunization record.
Let me provide an example.
Okay.
Especially looking around things like retaining data for any purpose. As an example, a state may have a law in place that prevents a QHIN or limits a QHIN from retaining data for any purpose. Well, if I as the public health authority have a direct relationship with a particular QHIN, I might have informed the QHIN of that as part of my contract with that QHIN, but the QHIN is still, another QHIN is serving other providers in the state. They're still bound by the state law because they've got that relationship with the healthcare provider. Somebody needs to undertake the role of educating every QHIN about any connectivity or any requirement for any provider or for any jurisdiction that has a provider that they are serving, if that makes any sense.
Yeah, so that does make more sense. And just kind of off the cuff in my thinking about that, this might be a prime example of why it's helpful that TEFCA is set up that doesn't require health departments to respond to queries, because in instances where a local law is so restrictive like that, where it seems, because I get what you're saying is that, let's say that first QHIN is only acting as a pass-through when the query is first run. So that QHIN is not going to hold the data permanently. But as soon as they send it out, they lose control over it. So I get that is part of the concern on this. So this could be an instance where the best way for a health authority to step into TEFCA is by querying data and not providing data back out. if the laws are in fact that restrictive. And
Sorry,
then, go ahead.
sorry, I don't want to dominate the conversation, but again, it's a two-way street that other providers in the state sending data to public health may not be using the same QHIN that the public health authority is using. That other QHIN is still bound by state law when they're serving a provider in that community. So if state law limits that QHIN's retaining data, they still need to comply with the law, and they need to take responsibility for understanding and complying with the law. It's not necessarily the public health authorities' responsibility to educate the other QHINs about what state law is. That's a responsibility that the QHINs need to undertake for themselves.
Okay, so in this hypothetical, the law that's restricting is specifically restricting QHIN's actions. I am not, I could have missed one, but I'm not aware of any laws that have been put in place yet in any jurisdictions that are saying QHINs may not retain data.
Well, it's intermediaries in some cases. It doesn't necessarily say QHIN, but an intermediary may not retain data. In the state of Texas, actually, there is a law that addresses HIE's role in sharing data and they can facilitate the providing of data to public health, but they're not statutorily permitted to retain that data.
Yeah, that will be an interesting, I think that will be an interesting thing to raise with any particular QHIN, because that might need to ultimately be something that goes back to the RCE to discuss about the terms within the common agreement. Because I get what you're saying, that this does create a broader issue where the rest of the QHINs aren't subject to that same agreement with the state of Texas or provider in Texas or healthcare network in Texas. So yeah, this is an interesting question. And I think it's going to have to start with a discussion with a QHIN about how will this be handled and how will they communicate this with other QHINs.
And to be clear, they're allowed to HIEs in Texas are certainly allowed under state law to report data and serve as a vehicle for reporting data to public health. I want to be absolutely clear on that fact. There are, however, limitations in their ability to retain that data.
Okay, great. That's interesting information. Thank you.
Thank you. I do want to make sure we have some time to see if we have other questions, and definitely a concern to dig into further. And Lillian, I know that you mentioned some resources earlier and had shared about the ASTO peer attorney group. I don't know if there's anything you want to share out about other resources that everyone should know about. Sounds like you guys are working on some of these sorts of things that I'm not sure if this whole group knows about. So I would love for you to
think
share.
that webinar is going to be the best place to start. And again, because I'm just coming back from 6 weeks out, I wasn't a part of planning it. So I'm going to be reviewing the slides for them tomorrow. But as of today, I don't have any additional insight into what else might be shared during that. So I think participating in the webinar, if you're able to, or viewing it later, I think.
But you have the peer, the state public health peer network that you guys work with to discuss some of these issues and inform some of this, right? That's what I was referencing.
Yeah. ASTO has a number of peer networks. If folks here aren't aware of them or aren't already a part of them, one of the networks is specifically for informatics directors. And then there's also one that I participate on for the public health attorneys too. And just to be clear, we are really trying to do as much educational and outreach information for the public health attorneys peer group that we run on TEFCA specifically. So the hope being, for those of you that are at state or territorial health agencies, the hope being that it's less likely that if you go to talk to your legal counsel and you say TEFCA, they're going to look at you like you're speaking a foreign language. Our hope is that they have a basic understanding of how this is going to work, and they've potentially even gotten multiple emails with things like the common agreement and the SOPs in them. So we're trying to inform from every direction we can so that these conversations can go a little bit more smoothly.
Thank you for that. I was trying to remember the name of the peer group. So I think it was worth sharing out for anyone who's not familiar. And we just have another minute left. I didn't see any other hands raised. I know that Mark had posted some information about the HT1/2 role. that's out for comment. And, you know, I think that the only other thing I would bring up is if there are any other agencies on the line who have experience similar to Fairfax, bringing agreements to legal, we'd love to hear from you. I'll give it a minute if anyone wants to share their experience. You may not have gotten that far yet. And I know we've heard from Washington and a few others in the past touching on this, but we do want to give you a moment. Okay. Not seeing any hands or comments, so I think we'll just move forward. Thank you again to you, Lillian, to Chuck and Stephen, Noelle and Ben. We really appreciate all of those insights and lots of advice. So we will have this recorded for anyone that wants to reference this later or share with your legal teams and so forth. With that, I'm going to just pass it over to Rachel for a quick update on the COP transition. Rachel, are you ready to unmute?
I am. Hello, everyone, and thank you so much for joining the COP today. And also wanted to say thanks so much to our speakers, especially Lillian. I know that you just came back from leave, and so really appreciate you joining in the discussion. I found it really, really helpful and good to hear some of the tips, and hopefully you all did as well. I did want to just take a couple minutes just to talk about some of the COP transition. So we're excited that we're going to continue the COP moving forward over the next couple of months. However, we are going to have to take a brief pause in the meeting cadence. So I think September we are going to skip in order for us to address some logistical types of issues. So our next meeting will be in late October, hopefully the 3rd or 4th week of October. And we will be in touch soon regarding a date, so stay tuned. Please let us know if there are any major events that a majority of the members on the COP may be attending the last 2 weeks in October, because we'll try and make sure that we work around that as best we can. We are still working through how this will be transitioned to the implementation center work moving forward. And over the next few months, we'll be sharing more as we think through that process, and also gauge more from you all as to how you might see it fitting in, or if there's some way of changing the COP, if there are other ways that you would like to how it should be organized differently, things like that. We would love to hear more about that. So we are really looking forward to continuing to learn and engage around TEFCA together. And I think that this has been a really, really fruitful COP moving forward. And I did want to say that my counterpart, Abby Weil from CDC, was unfortunately not able to be on today's call, but she wanted to also express her thanks, and she's also looking forward to continuing the work together over the next couple of months. So with that, Liz, I will hand it back to you.
Rachel, can I ask one quick question?
Sure, Steve.
Is an opportunity for you to promote something else. Is there any opportunity to have a in-person discussion at the ONC annual meeting? And is there going to be TEFCA content at the annual meeting? And can you tell us more about the annual meeting?
I cannot tell you anything more about the annual meeting, that it went out and that it is in early December, I believe. I'll put information in the chat about that. As it relates to TEFCA, I'm sure it will be on the agenda. We are currently working through on the agenda as we speak and trying to develop some fruitful discussions for you all. And I will definitely put it on their radar that you all are very interested in continuing the discussion of TEFCA in person. So thanks so much, Steve. Well, definitely.
And just to add, there's no cost to register for the meeting, but travel costs and hotel costs are the responsibility of the attendee.
Thanks, Steve. We will be sure, Rachel, if there's any other updates at future COP meetings, we can share those out that are relevant to TEFCA as well. So I think to continue on to where Rachel was going and discussing the momentum of this COP, we really do want to take a couple minutes just for some high-level questions from you all. We're going to switch over to Menti for just 2 quick polling questions on what you would like to see out of a future COP. So if everyone can go to menti.com, the code is on the screen here. I'll give it just a second, and Lux is going to
I have
take over
shared the
the
link
screen.
on in the chat also. So if people want to go in there and check.
Oh yeah, the full link is in the chat from Lux. I think there's more to it than just the menti.com on here. Okay. So while you do that, Lux is going to share her screen. And these are just a couple high-level questions that we had. I think, Lux, you can go ahead and pull up the first one, and it'll show us how many people have been able to join on there.
Can you see my screen?
We can see it.
Okay.
At least I can. We'll give people a few minutes. Again, if you need that code, it's in the chat. It's menti.com, and then use code 3441036. And so, as you see on the screen, we just want to kind of, in general, hear what you would like to see more of, and, you know, to think further about that, what has been most valuable to you out of this rendition of the COP. And this is a word cloud, so I think limiting yourself to a few words is great to kind of see. So we're seeing a lot of the use cases. I see the legal discussion, which is great for feedback for today's session. But really just being able to hear from each other is kind of coming up here. Looks like we have room for more people to join the Menti if you still want to participate. I know we're getting to the end of the meeting, but this will just kind of help us as we do think through what the future of this looks like. Early successes, legal implications, use cases, promise. I like that. I don't see getting to yes yet, but the legal discussion is here. Clarity on charging. Does anyone want to expand on that? No pressure.
Hey, Liz, this is Mary Beth, and that was my comment, because we've heard some just rumblings from a TEFCA presentation earlier in the week to the HL7 group about who can charge. So, for example, a consumer access application might be able to charge, but IS couldn't necessarily charge, which I think brings up questions about if IS are already charging, say, payer groups to get HEDIS data. So and I think this is still an evolving area as we work out the use cases, but it'd be great to have a discussion about that just as we think about the logistics of implementation.
Thank you so much, Mary Beth.
Yeah, thanks.
Does anyone have anything to say to respond to that at this point? Who's on the call? It's definitely a topic we haven't brought up yet on the COP. Mary Beth would appreciate adding that to future things to discuss.
Hey, this is Mark from ONC ASCP. It's a good question. I'll say that we are working on the fee structure across the board for the different exchange purposes. In the current exchange purpose SOP, which I can plug in a link in, there is a table that at a very high level discusses fees, but it sounds like the question is a bit more granular and, I think is probably handled at the network level, because TEFCA really, with regard to fees, the only thing we've said is that QHINs can't charge other QHINs fees, and they have to be reasonable under applicable law like information blocking.
Thank you, Mark.
Yeah, thanks, Mark.
Lux, can you pull your screen back up, or is it just me? You can see the rest of the word cloud. Oh, there it is. And then, all right, I'll see, is there anything else? Integration, standardization. Okay, lots of themes that have come up throughout. So thank you for sharing. And we will jump to one more question. And this is, just kind of suggestions from you all. Is there something that you would change? Have you participated in another COP that you have experience with that offers recommendations to how you would like to see changes made to this COP, whether it's how it's structured, more engagement, different activities? We'd love to hear any feedback you have related to what you'd like to see in the future. I'm not seeing anyone enter. Is everyone, did this advance for you all on your browsers? We just have a couple minutes. Lux, I'm not sure if it's a technical difficulty or if people are just kind of ready to wrap up. So I'll give it like 30 more seconds. Again, it's menti.com. Oh, we have something great.
Yeah, I think they're still typing.
Yeah. This one gives you more space than the word cloud for responding to. So the suggestion is to kind of focus on COP structured around kind of some promising priority use cases. Any other suggestions? Well, with the time crunch here, and we have just a couple more slides to walk through, including that link to the informational webinar that Lillian mentioned earlier, I will, next steps for public health SOP. Yes. And if you didn't see in the chat, Craig added a link to the RCE informational webinar from Tuesday that did touch on a little bit more with the public health SOP. So you can see that link where the recording will be posted in the chat from Craig. Also, Rachel alluded to an upcoming webinar, hopefully in September. We'll try to share that out once we know details with you all. Hearing from the QHINs, great ideas. Okay, well, you have more opportunity. I'll go ahead, Lux, I can take back over the screen. And so with the next slide, we just have a link to a post-meeting survey. And I actually need to take over the screen. Sorry about that. Okay. I need to get back to my slides. Sorry, everyone. I just have a broken wrist and my brace is not letting me adjust through the slides. Let me see what I can do here. You see the post-meeting survey, so you do have more of an opportunity to provide that feedback and ideas and recommendations for the future of the COP through that survey. And I just wanted to make sure we get to this slide with the FIG Implementation Center informational webinar that Lillian mentioned earlier next Wednesday from 2 to 3:30 Eastern Time, which will provide an overview of the IC program structure, as well as how PHAs can express your interest to participate. So Lux just posted, in addition to the post-meeting survey, she posted the registration link for that event, and hopefully you've all had it on your calendar, but if not, it'd be great to check out and learn more. So again, as Rachel shared earlier, please be on the lookout for more details related to an upcoming late October meeting to continue the momentum of this group, and as the ICs get stood up, and to determine how this will be structured going forward. So thank you all for your participation today. Thank you to all the speakers for the wonderful information shared. Please reach out if anyone has questions, and we will send out the recording when it's available. So have a great rest of your Wednesday. Great to see you all.
Thanks, Liz.
Thanks, everyone.